Hey there, future nurses. Let's dive into the world of mental health nursing, where we care not just for the body, but also the mind. What is mental health? Mental health means more than just the absence of mental illness. It's about being flexible, solving problems, forming healthy relationships, handling daily stress, and feeling good about yourself. A quick look back, the history of mental health care. In the past, people with mental illness were often placed in asylums unsolely, treated inhumanly. Some were even used in experimental research. Thankfully, things have changed. In 1955, mental health nursing theory became a requirement for nurse licensure, and by the 1970s, medications like phenothiazines helped cut hospitalizations in half. Assessing mental health assessments are usually done by trained professionals like RNs, social workers, or therapists. They look at things like appearance and behavior, orientation and awareness, thought content and clarity, mood and affect, speech, memory, judgment, and perception. Communication. It starts with the interview. The intake interview is where it all begins. It helps us understand the patient's needs, often using closed-ended questions, especially if the patient is anxious or angry. But we can also use open-ended questions when needed, like, can you tell me more about how you've been feeling lately? Stress and coping. Let's talk stress. Stress can be positive, like starting a new job, or negative, like losing a loved one. Stress leads to anxiety, which triggers the fight or flight response. Coping is how we manage stress. Some coping methods are healthy, others not so much. Our job is to help patients develop effective coping strategies. Physical effects of stress. Stress doesn't just affect the mind, it impacts the entire body. Nervous system. High blood pressure, high heart rate. Respiratory, fast breathing or asthma attacks. G-system. Bloating, diarrhea, constipation, muscles, tension, headaches. Reproductive, irregular periods, decreased libido. Immune system, more prone to illness. Mental health treatments. Treatment options fall into two main categories. 1. Psychopharmacology, aka medications. These include antipsychotics, anti-anxiety meds, antidepressants, mood stabilizers, stimulants. 2. Psychotherapies, aka talk therapy. These include psychoanalysis, explores unconscious problems. Cognitive behavioral therapy, connects thoughts, feelings, and behaviors. Rational emotive behavioral therapy, or EBT, challenges irrational beliefs. Group therapy, animal therapy, light therapy, and more. There's even electroconvulsive therapy, ECT, and transcranial magnetic stimulation, TMS, for treatment-resistant cases. Complementary and alternative therapies. Patients may also explore yoga, massage, and aromatherapy. Herbal supplements, but always check for interactions. Biofeedback helps control physical stress responses. Guided imagery and relaxation techniques. Remember, respect your patient's cultural beliefs when it comes to alternative treatments. Anxiety disorders. Generalized anxiety disorder (GAD) involves persistent worrying for 6 months or more. Treatment includes medications like benzodiazepines or buspirone, CBT, relaxation techniques, therapy, and even acupuncture. As nurses, monitor for side effects like drowsiness or dependency. Educate patients not to stop medications abruptly. Depressive disorders. Depression affects how a person thinks, feels, and functions. It's often linked to low levels of serotonin and norepinephrine. Treatment includes SSRIs like fluoxetine Prozac or sertraline Zoloft. Therapy. ECT or TMS, light therapy especially for seasonal depression. Nursing care should focus on safety, goal setting, and encouraging the patient to challenge negative thoughts. Always watch for suicidal ideation and take action right away if there are signs. Antidepressant medications. There are several classes. SSRIs, fewer side effects, but may take 4 weeks to work. TCAs and MAOs, older and often more side effects. SNRIs and tetracyclics, newer alternatives. Always teach patients to avoid alcohol, monitor for serotonin syndrome, and never stop medications suddenly. Final thoughts: mental health nursing is about compassion, awareness, and advocacy. You're not just treating a diagnosis, you're caring for a human being, often at their most vulnerable. So stay curious, stay kind, and remember, you have the power to make a real difference.